Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment of the show, I'm going to bring up a new type of cancer, which is cancer of the liver. Cancer of the liver is extremely common. Unfortunately, it's the fifth leading cancer in the world. According to the American Cancer Society, this year, 40,710 individuals will develop cancer of the liver and biliary trees. Of that number, 28,920 folks will die of this cancer. It's extremely common. Now, worldwide, some 745,000 folks will develop cancer of the liver, and of that number, each year, about some 20 or so thousand folks died of cancer of the liver. Now, the liver is the organ that filters all the major toxic material that we inhale, some of the stuff that we drank, some of the stuff that we ate, and some of the stuff that our skin come in contact with. Much by necessity go to the liver to be processed and dumped into the skin to be excreted, etc. So a whole tremendous amount of blood flow goes to the liver every single moment of every time that we are alive. So therefore, it is, in addition to that, many cancers metastasize to the liver. So when one sees an abnormality in the liver that looks like cancer, it is not clear as to whether or not it is basic to the liver or has metastasized to the liver from somewhere else. Now, there are different things that can cause someone to develop cancer of the liver. Hepatitis, I'm talking about de novo cancer of the liver, hepatitis B, hepatitis C, alcoholism, hemochromatosis, which is iron overload, alpha toxin B1, cirrhosis of the liver, abuse of anabolic steroid, diabetes mellitus, obesity, exposure to industrial toxin, liver flukes, vinyl chloride exposure, arsenic exposure, taurine dioxide exposure, Wilson disease, etc. So all these are representing risk factors. And of course, as I mentioned before, metastatic cancer to the liver is a different subject, and that is also more common than the basic cancer of the liver itself. Now, let's talk a little bit about the symptoms of cancer of the liver. General weakness, lassitude, tiredness, weight loss, headaches, nausea, vomiting, alcoholism, needle marks from drug addicts, cirrhosis of the liver, jaundice, itching, enlargement of the liver, enlargement of the spleen, portal hypertension, esophageal varices, vomiting of blood, hematemesis as I described last week, ascites, abdominal mass, etc. So those are the symptoms. So if one patient presents with these symptoms, the list of things that can cause them, of course, is quite long. However, the starting point will be you take a history of the patient, that you talk about all these different things that I mentioned that the person may have been exposed to, etc. The different habits such as alcohol abuse, obesity, etc. And of course, hepatitis. Hepatitis B, hepatitis C in particular. Believe it or not, the most common cause of liver disease as it relates to cirrhosis happen to be obesity. You say, well, how do you go from obesity to cirrhosis of the liver? Well, the mechanism of that is why I said in previous shows, it is basically impossible for someone to be obese and be healthy. You cannot be, for a variety of reasons. Now, the obese person has accumulated tremendous amount of fat that has been deposited in all the soft tissues of the body. That's why the obesity comes becomes to be. However, there's only a limit to which the soft tissues can handle the fat. It reaches a point where no more fat, no more space for the fat to be deposited, and the fat then penetrated into the liver, and you develop a condition called fatty liver. Once you develop fatty liver, by necessity, the fat must be broken down. As the fat is being degraded in the liver, a series of substances called free radicals get released. Once these are released into the liver, then you have a local inflammation. Once you have these chronic inflammations, then that ultimately is going to lead to cirrhosis of the liver. You can't have chronic inflammations in the liver for whatever reason without ultimately developing cirrhosis of the liver. And you say, well, how do you go from cirrhosis of the liver? Because there's not really one cause of why someone develops original cancer of the liver. It's almost always, unless it's a genetic issue, it's almost always because something happened to the liver that has caused damage to the liver. And almost always that damage results in an inflammatory process. It is the inflammatory process that ultimately damages the cells of the liver, which then ultimately cause the DNA inside those cells to become abnormal, and then you best start developing cancer cells, etc. That's how you develop cancer of the liver. So now that you have an idea how exactly that happens, and you take a history from the patient, then you're going to proceed to examine the patient. The examination really has to be extremely detailed. Because when you're examining somebody with cancer of the liver, you want to look very carefully at the skin, extremely carefully at the skin. Because there are several things you could find on the skin that can give you an idea. Number one, is the skin yellow? And if it's yellow, how yellow is yellow? Number two, you have a whole lot of little pseudo vessel, artificial vessel that develop. We call them spiders. They look exactly like those spiders on the surface of the skin. Those can be seen by the eye. Okay, so the skin extremely important, and then the itching that's going on because the liver is incapable of getting rid of all the bile that's accumulated that it is producing, and the bile then becomes a salty material, and the person is itching, scratching all the time. You could see the scratch mark. And also, let's say you're dealing with somebody who's a drug addict. Well, take a look at the skin. You're going to see multiple marks to the arms, the legs, and stuff like that, where this person has been injecting himself or herself with drugs. Those marks, they don't go away. Okay, so the skin, which happens to be the largest organ in the human body, is extremely important in the evaluation of a disease involving the liver, such as cirrhosis, which can ultimately lead to cancer of the liver. So it is very, very crucial. Then the next very important thing that you want to take a close look at the person's eye, the white of the eye called the sclera. Is that yellow? And if it is yellow, we grade it from choice to 4. It's a choice jaundice from 1 to plus scleral teres, we call that. So that's a very important thing that we're actually looking at, okay? Looking at. Then in the evaluation as well, you have to understand that when you're evaluating, let's say you're evaluating a man who comes in with problem with the liver involving cirrhosis, etc. Because the disease is, the liver is sick, they are all men by necessity produce a certain quantity of female hormone. That's right. when the liver is in good shape, healthy, the liver is able to get rid of that hormone as the hormone is broken down. However, when the liver is very sick, that little bit of estrogen that the man carries in his body cannot be broken down, cannot be gotten rid of. So that accumulates. So the man's breast will be enlarged. That's right, gynecomastia. See, I'm telling you all this stuff because you can't build a house or building properly if the foundation is not well built. So I got plenty of time to talk to you about cancer of the liver, but I'm giving you some of the basics. And I'm not going to apologize to you or anyone else because of my knowledge of these things. Basically a medical educator. That's what I am really. I practice private medicine because I want to be financially independent, administratively independent. But my actual job is basically to teach, and which is what I do. Okay, so so those are very very important things. Okay, if you doing that, you're doing the examination in the women, then you got the reverse. All women, all women were created by God to have a certain amount of male hormone, androgen. That's right. And you don't see it, it's not obvious to you because her liver is functioning properly. So the little bit of male hormone that's there is being controlled by the large amount of estrogen that she carries, and that keeps that under control. By the way, it is frequent that women patient will come to my office discussing the very brutal symptoms of menopause. And these are highly educated women, most of them. And to this day, the folks whose job it is to really explain to them in detail what menopause really is, what's causing it, has not yet explained it to them. I find that quite disturbing. Why? I have no idea. What is the big secret? You can't tell me, because I do not have a monopoly to this knowledge. You can't tell me it is such a mystery that all women, by necessity, the way God created women, must have a certain amount of testosterone in her body and androgen. So when she's menstruating properly, the ovaries are secreting the normal amount of estrogen. That little bit of testosterone is kept under control. It's kept under control. The minute she is no longer able to produce that much estrogen, then that little bit of androgen or testosterone that she has in her body is not being checked on. It's out of control because there's nothing to check on it. And my friends, that is the basis of menopause. It has a tremendous amount of other factors, but that is the real basis of it. This book has a section on menopause. This book you're looking at, The Art and Practice of Modern Clinical Medicine, that describe that fully. I find it mind-boggling that no one has to, of all this discussion that you hear on television, on this and that, all over the place about menopause, no one, or whatever reason, is afraid of. What's there to be afraid of? This is how God created. So therefore, that is why when women are postmenopausal, they become very agitated, they can become depressed, they sweat a lot, some of them develop hair in the face, etc. This is all because of that little bit of testosterone that's now is out of control because the level of estrogen has gone down. It's not keeping it on check. And you wonder, well, why did God put that little bit of testosterone there? Well, my friend, without that, no woman would ever have sexual desire. That is the reason. To tell me in the 21st century that I would be the only one to have access to that information, this is nonsense. I don't have, I'm not the only one to have access to it. But people will not talk about it because you can't tell me something as important as menopausal symptom. Somebody would know about this thing, would absolutely fail to release that information to patients under the care. I find that mind-boggling. And believe me, patients come, these are highly educated people, physicians, attorneys, people with high degrees of education of all type, all level. Nobody ever told them this information. Why? I have no idea. And then all these other garbage that have been shoved down people's throat every day on television, people making millions of dollars off them, pushing garbage down their throat, thinking that that's medicine. This is nothing but hogwash. And I find that disturbing, absolutely disturbing. But that's the world we're living in. It's a free society. People have the right to go on TV, say whatever they want to say, so long as they're not saying something that is not acceptable on TV, and it's up for other folks to be not to believe that nonsense. But obviously people do, because they keep watching these low-level nonsense trash shows, because people skin color allows them, give them the passport, the license. They need to go on television, make a name for themselves with absolutely zero knowledge. Let me tell you something. General clinical medicine is an extremely difficult field to keep up with. That is why people who have committed themselves to become general internists must constantly be reading, keeping up to date, to know what they're talking about. And you have people who know absolutely zero what they're talking about. No question, they may have little something to do. They know how to cut somebody's toe or something like that. That doesn't give them, that shouldn't give them the license to go on television talking about thyroid. Absolutely, they don't know what they're talking about. They couldn't possibly do, because that's not what they do for a living. And they're abusing the fact that they have an MD behind their name and making millions of dollars off it. I don't care. I'm not interested in making money. I have been offered many, many times in the 25 years I've been doing this show to commercialize it. I said, no, I'm not interested, because I want to have my independence, to tell the truth, to speak real stuff. Because I have people all over the world who are in the field of medicine who watch this show. 25 years, I'm yet to receive an email, a phone call, or a postcard saying, Val, you say something on television that was not true. 25 years. That must be a record. In any event, so women then will have a lot of issues, because the liver is not functioning properly. They have more estrogen on board than they should. They have breakthrough menstrual bleeding, breakthrough vaginal bleeding. They have a whole host of other issues that they're dealing with because the liver is not functioning properly. The whole concept of what people do as it relates to the blood pressure, etc., fluid accumulation, etc., because there's a whole host of stuff that must be broken down by the liver. But when the liver is very sick, the liver cannot do these things, and these things accumulate. As I develop the show having to do with cancer of the liver, I will describe to you all the stuff that are abnormal with the liver when somebody have cancer of the liver, etc. So you really have a good understanding about liver physiology, when the liver is really normal, when the liver is really abnormal. So both men and women develop hormonal issues when the liver is not able to break down these hormones to the finite point and excrete them in the urine and pass it in the stool, etc. So now that we've done the physical exam, well, we haven't really finished. Come on. We talk about the skin, we talk about the eye, we talk about the breast, we talk about these other issues, but how about the liver itself? Well, you got to examine the abdomen. You got to examine the abdomen. When you examine the abdomen, what you're going to find? Well, you're likely to find an enlarged liver, or you're likely to find an enlarged spleen. Well, how do you go from enlarged liver to enlarged spleen? Well, here's the deal. When the liver is very sick, inside the substance of the liver, there's a lot of obstruction of little vessels deep inside the substance of the liver that is obstructed, and the flow is being interfered with. So then you have a backup of the pressure, something called portal hypertension. Once you have portal hypertension, then you're going to have enlargement of the spleen. So you have enlargement of the spleen, then you wind up with, because of that, then you could wind up with esophageal varices. All these things going to happen. And once you have esophageal varices, you're talking about vomiting blood. I did mention hematemesis before. That's where you're vomiting the blood. That's where that's coming from, etc. And then the whole concept of pancytopenia. Once you have portal hypertension, then we are in a new ball game. What we're talking about, because the liver, the spleen is enlarged, the spleen is going to suck up your white cell, suck up your platelet, okay, and then hemolyze your red blood cell. So you got pancytopenia, okay? So all three cells that are circulating in your blood are going to be abnormal because of the so-called, the level is going to be abnormal. Well, it gets worse than that. Because of that, you may wind up also with most 99% of all the coagulation factors that we need so that we don't bleed spontaneously are made in the liver, except one, factor 8. Factor 8 is produced in the wall of the large vessels in the body, in the body. Okay, all the other ones are made in the liver. Well, the liver is sick, too sick as a factory to produce these things. So the person can bleed spontaneously as well. Okay, and you are at risk of bleeding because your partial thromboplastin time is elevated, your prothrombin time is elevated, so you develop coagulopathy. Now you have thrombocytopenia, meaning your platelet is low, and you have coagulopathy, meaning your coagulation levels are abnormally. PT is high, PTT is high. So you are set up for severe bleeding. So it is a possible catastrophic situation that we're dealing with. Now, there are many things, other things that can cause these things to occur. I'm talking about cancer of the liver. When the liver is infiltrated with cancer, be it metastatic cancer or be it hepatoma. The cancer of the liver that is originated in the liver itself is called hepatoma. Okay. All right? It's called a hepatoma. Now, you could see all these things because you've already ordered, we did the examination, the liver is enlarged, the spleen is enlarged. You also have to make sure that the abdomen doesn't have fluid in it, ascites. Because when the liver is very sick, I alluded to the fact that before, there's certain things that are produced somewhere, in the kidney, for instance, when they get to the liver, they cannot be broken down. You have secondary hyperaldosteronism, and then you wind up with salt retention, secondary fluid retention, you have ascites. How about that? All because the liver is not able to break down the aldosterone that is produced by the kidney and so on and so forth. Okay. So you must have all these things in mind as you are examining the abdomen. Okay. There are other parts of the anatomy that you're dealing with. Clearly, the rectal exam is very important because you could find blood in the stool that the person is bleeding. He or she didn't know because of all liver issues and so on. You test the stool for blood, etc. Okay. Now you get to the bigger guys. That is, you're going to do a complete blood chemistry profile. Complete. You're going to do a complete blood count. You're going to do a urine analysis. You're going to do a PT-INR, PTT. You're going to do all this stuff. This is the basic stuff that you do. You send to the laboratory. You're going to do the chemistry profile will show you the bilirubin, which is likely going to be elevated. It's going to show you the alkaline phosphatase, which is inevitably is going to become elevated. All these things are going to become abnormal because the liver is so sick. Okay, the LDH, SGPT, PTT, SGPT, SGOT, all these things are going to become abnormal. Okay, so now the question is you have to do alpha fetoprotein. Why? Because if it is a hepatoma you have, your alpha fetoprotein is going to become abnormal and so on and so forth. So you do all this stuff, then you proceed, of course, to do a regular chest X-ray, blah 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 blah, and so on and so forth. Those are the routine stuff. Then, of course, the next thing you would want to do, you do an abdominal ultrasound that will show you exactly, objectively, how big the liver is and is not, etc., or is there a mass inside the liver, such as a hepatoma, or there are multiple little masses that are metastatic disease somewhere in the body that has landed in the liver. And the next test, of course, would be to do a CAT scan of the abdomen. Those are the radiologic things, the chest X-ray, ultrasound of the abdomen, and CAT scan of the abdomen. Those are the tests that you will do in the beginning. Got a long, long, long way to go. Believe me, you have a long way to go. But you will do these things to give you an idea what really, objectively, besides what you feel when you examine the patient, is going on. And you will get these things back, and you sit and evaluate them to find out how anemic the patient is. Remember, you do a reticulocyte count as well. How anemic the patient is. How low is the reticulocyte count? Because it is, how high is it? If there's hemolysis, it's going to be high. If it's normal, it could be low. Very, very important. You need to know these things, okay? And then now that you got, how high is your performing time? Is it safe or not safe to handle this as an outpatient, etc.? Those are the things you're going to look at. And then once you begin to look at it, this gives you an idea. And then you would know what's the next step is going to be. Listen, I'm going to stop here. Next week, I'll continue the discussion about cancer of the liver. Until such time, keep watching the show. This is Dr. Alcena saying so long and bye-bye.